Okay, so without further ado, I would like to welcome and introduce our first speaker, Paul Niblett, who is Deputy Head of Population Health Analysis at Public Health England, and he's going to present today on the association between obesity and COVID-19. Thank you, Paul.
Okay, thank you, Kath, and thanks for inviting me to speak. Okay, so what I'm going to talk about is to highlight some of the evidence that's become available on excess weight as a risk factor for COVID-19. So in Public Health England, we've recently published two reports, which some of you may be familiar with. So around the beginning of June, we published the disparities report, which didn't really focus on excess weight too much, but there was a summary of the analysis that was available at the time within that report on pages 61 to 62. And then more recently, at the weekend just gone, the excess weight and COVID-19 review was published, which built on that evidence in the disparities report and was a much more sort of exhaustive set of evidence. Let me just go on. Okay, thank you. So initially, this is kind of split into three sections. So initially, we're going to talk about excess weight as a risk factor for admission to hospital. Let's go on to the next slide, please. So first study I want to talk about was by Kantar, which linked COVID-19 test data with Biobank data, which I'm sure several of you are familiar with. The study used data from around 400,000 individuals, and the testing, so it's linked to the test data for tests which had taken place between mid-March and mid-April, when the testing at that time, if we can all remember back, was pretty much all taking place in hospital. So therefore, if someone had a positive test, then it almost certainly signifies they'd been hospitalised with COVID-19. The chart on the right is the forest plot from the paper. Throughout these slides, I've quite shamelessly copied forest plots and tables across from the different papers. But as you can see there, it's quite clearly showing, particularly for those with a BMI greater than 35 kilograms per metre squared, that the odds ratio was just over double what it was for those with a healthy weight in terms of risk of being hospitalised with COVID-19. Okay, thank you. And then this next study, this was by Hamer, also using Biobank data. This one wasn't available when wasn't published when the disparities report was written. It's also using test data over a slightly longer time period, up to the 26th of April. Again, it's the same assumption though, because most of the tests were taking place in hospital at that time. And the table on the right is taken from the report. The yellow box I've kind of added there is the risk factors when the model had been adjusted for sort of demographics and other conditions. And again, it's for those living with obesity, the relative risks are roughly double, 1.97, to what they were for the healthy weight group. Okay, the next couple of slides are around admission to ICU, so going into hospital, but more seriously going into ICU. This first slide here uses data from ICNARC, the Intensive Care National Audit and Research Centre. It's using the data up to the 20th of May, which is what was published in the disparities report. They have been doing weekly reports, although the figures haven't changed that much. So what this report was showing was that of all of those people in intensive care, 7.7% of them were in the morbidly obese category, which compares to only just under 3% that are in the general population. And this disparity was seen when looking at white and non-white patients separately. And then the chart on the right is, again, taken from the report. So there was some multivariate analysis done within that report as well. And it's showing that beyond a BMI of 30, as you go, well, basically as BMI increases, then the risk of being admitted to ICU increases as well. And then this is a study which hasn't been published yet. We were lucky to get sort of pre-release access to it for the report review, which was published at the weekend. So it's by Hippisley Cox, and it's using GP data this time, so a much bigger sample set of around 8 million individuals. So COVID test data and ICU data were linked. Again, test data was around the time when all the tests taken place in hospitals. This particular chart we're looking at here is actually the model for admission to ICU. Again, it's been adjusted for demographics and different treatments and other conditions. And it's showing for those in the group with a BMI greater than 35 kilograms per meter squared, then the hazard ratio for being admitted to ICU was 4.35 compared to those in the healthy weight category. And the paper also does look at positive tests as well. And the odds ratio for that same group was 1.54. So last couple of slides on this can look at mortality. So a paper which was mentioned in Disparities report, it hadn't been peer reviewed at the time, but it's the OPENSafely paper using electronic health records, which uses data from around 17 million individuals and had, at the time the Disparities report was written, the analysis only included deaths in hospitals up to 25th of April. And so relative to those who were in the non-obese category, for those BMI greater than 40 kilograms per meter squared, the odds ratio was 2.27, so double chances of dying from COVID-19. The figures were revised slightly in a more recent version of the paper once deaths outside of hospitals have been added, and that came down to 1.92. So just a summary of what the evidence that we've kind of seen here. So we've looked at evidence which was in 2 PHE reports. There's a lot more evidence mentioned in those documents and in general evidence generally, which isn't included, around this sort of subject, and particularly some international research, which I haven't mentioned. In the excess weight and COVID-19 report, there's a really useful table which covers quite a lot of the different research and explains the background to it and what the findings are. There are some caveats around all of this, in that not everyone has been equally exposed to COVID-19. It could depend on kind of whether you're in an urban or a rural setting, what somebody's job is, etc. And the testing strategy at the time could have impacted the results. So initially it was all in hospitals, and then it was sort of key workers who had symptoms, etc. There are some biases in the data sets used for the analysis, and not all the papers have been peer reviewed. However, there's been some great work taking place really, really quickly, which has really helped us in PHE to get kind of a handle on this. And the UK, both the UK and the international evidence is suggesting that obesity, increased BMI and obesity in particular, is a risk factor for COVID-19 severity and mortality. So in PHE, we're keeping a watching brief on emerging research, and we are hoping to do our own piece of research as well. So we're working with NHS Digital to get access to their new GPES extract, and our analysis will be similar, and I'm sure we'll get similar results, but hopefully it will be a much bigger data set. So we'll be able to potentially look at some subgroups in a bit more detail and have shorter, smaller confidence intervals around some of the results. Let's go on to the next slide, please. So I just want to finish quickly just by telling you about a new data resource which we've been publishing in PHE. So the wider impacts of COVID-19 on health. I mean, essentially it's a dashboard which brings together a lot of data related to COVID, but on the indirect health impact. So there's nothing in there around sort of deaths or cases. And I'll give you an example of what is in there in a moment. It's updated every Thursday at 2 o'clock, and there's the link there if anyone wants to go and have a look. Go on to the next slide. So that's the front sheet that you go onto, and basically you just sort of, where it says homepage at the top and then grocery purchasing, etc., you just kind of move along there and you can see the different pieces of information. Let's go on to the next slide, please. So just quickly, this slide is showing you weekly grocery purchasing data. This is volume sales, which we've been buying from Kantar. The first peak you can see there is Christmas, and then the secondary peak is when lockdown was announced. So this is going up to the Sunday before the Monday when Boris Johnson did his announcement. Then you kind of see sales drop off as we go into lockdown, and then they rise back up, and they've been higher than pre-lockdown levels. However, it's important to note here that obviously the other thing that's happened here is the eating at home sector is pretty much closed down. So we don't necessarily know whether it means more food and drink is being consumed overall. because some of this may just be displaced purchasing from the out-of-home sector. Let's go on to the next slide, please. This is just looking at category level. So you can see there, year to date, percentage change compared to the previous year. Alcohol is a category that's showing the biggest increase, just over 30%. However, as I said before, some of this may be displaced purchasing that would have been in pubs and restaurants. And then home cooking and snacking are the next most popular things. Interestingly, oral care is the only one that's gone backwards, so we're not brushing our teeth as much as we were last year. Let's go on to the next slide. And just quickly to finish, there's some information in there on physical activity as well. This is from a Sport England survey, which has been running during lockdown, showing the proportion of people saying they're doing less than, not doing 30 minutes physical activity on any days, or they're doing it on 5 or more days. Let's go on to the next slide. And this is a question saying whether they were doing more or less physical activity. You can see there, it's a bit higher in terms of people doing less physical activity. And there's lots more information in the tool on sort of smoking, gambling, and various things that people can go and have a look. And that's me finished. Back to Kath.